January is Glaucoma Awareness Month. Today we have UofL Health's Dr. Joern Soltau here with us to talk more about the second leading cause of blindness. Thank you so much for coming on today.
Yes, well, thank you for having me. Yeah, it's very important. January is Glaucoma Awareness Month. Glaucoma is the leading cause of irreversible blindness. It's caused by elevated eye pressure, and it's important to detect it early because it's irreversible.
So let's talk about some of the symptoms. We were just talking in commercial break. It can be difficult to detect early because it's hard to tell. There's no real symptoms early on.
Right. Glaucoma is also called a silent thief of sight because early on there are no symptoms. You get symptoms, notice something's wrong with your vision only late in the disease. That's why eye exams early are important to detect it.
What are some of the symptoms later on that you might notice, and when is it time to go to the doctor?
Well, it's never too late to go to the doctor, so it's always early. To be preventative is important. Symptoms are somewhat blurry vision, glare, that you feel something is, but don't wait until you have symptoms. You need to have it, so especially if you have a family history, if you have an African heritage, you got to have an eye exam regularly, at least at age 40, once a year, to make sure that you don't have glaucoma.
Let's talk about who is most at risk here.
Again, if you have a family history, very important. It does run in families, and here in the U.S., it's African Americans are at a much higher risk of developing glaucoma.
So if you do get this diagnosis, what are the treatment options? What do you do to help your patients?
Well, regular eye drops. Most patients are only on one drop a day at night to lower the eye pressure, keep the pressure off the optic nerve. That's where the damage occurs. Sometimes you need two different eye drops, but if those don't work, then there's laser surgery also, or incisional surgery to lower the eye pressure. So there's treatment available, definitely.
Lots of options there if you do get the diagnosis.
Right, you don't have to be afraid to get the diagnosis because we can treat it.
And is there any way for people to prevent this?
Not really. Early detection and treatment is the key. So then you can prevent going blind if you treat it early.
Okay, so those eye exams really the most important thing to walk away with tonight.
That's correct.
Okay, Dr. Soltau, thank you so much for coming on.
Thank you, it was a pleasure.
January, Glaucoma Awareness Month, great reminders here.